Hello, everyone, and welcome back to the Circles Project. My name is Kristen Shamanik, and I'm a respiratory therapist here at the COPD Foundation. And today we're going to talk a little bit about the My COPD Action Plan and the tips for living well with COPD flyer. So in the Circles program toolkit, you received a fit kit, which contains several different health and wellness items, a few fun freebies and extras, and also a couple of educational materials that are going to be very, very helpful to you as you move on in your COPD journey. So today we're going to talk about two of those forms that you received in your kit, and those are the My COPD Action Plan here on your left, and the tips for living well with COPD, which is shown on your right. So let's dive a little bit deeper into these tools and see how to best use them. So the My COPD Action Plan is the first one we're going to talk about today. This is one of our most important tools that really benefits anyone with COPD. This is designed to be an action plan that you can use on good days and bad. It really gives you a plan that you can follow on any day, a good day, a medium day, and just those really bad days. And what you're going to do is you're going to take this document, you're going to fill it out with your healthcare provider or with your healthcare team, and you're going to tack it up on your fridge with your little magnet clip that we gave you in your kit, or you can stick it by your phone or wherever you're going to remember to use it. But let's talk a little bit about how to use it first. So what we're going to do here, let's zoom in a little bit. So this is the top part of the document. And on here, you're going to fill out everything just as it's listed. So first is your name and the date that you made the plan, because the other thing to remember is that these plans do change over time. So your plan today may not be the same plan you're going to have next year or even 5 years from now. So you're going to want to revisit this plan with your doctor each time you come in for an appointment, or at least every year or so. So you're going to fill out your name and date. You're going to fill out your doctor's name, and you can probably fit a few different doctors on there if you'd like to keep them all in the same place, and also add their phone numbers. And you're going to add your emergency contacts and their phone numbers. Because remember, if we're going to be tacking this up on our fridge or keeping it in a really prominent place in our house, we're not the only ones who could use it. You know, your children or your friends or whoever might be visiting you could also use this in an emergency. This is nice because they would know exactly who to call if something should happen. So the next thing you're going to do is look down to this grid here at the bottom. Now this is our, it's two things actually. It's a goal setting sort of worksheet here to help you to figure out what you can do well, what you'd like to do, and what you need help with. That's one thing. But it also gives you a better idea of sort of how you're functioning on a daily basis. You know, are you able to do the things you want to do, or do we need to make some changes? So let's look at this grid. So for each one, let's take the first one, for example, cleaning. You're going to check off the box that applies to you. So can you do it well? Can you do it with a few limitations? Do you have a hard time with it? Or can you just not do it at all? It's just too much for you, too much effort. See which one fits for you and then put a check mark in the box. And then you would do the same for all of the other items here. Now, when you get to the very end, you'll notice there's a blank box. That's the one where you're going to want to put something else in there. You're going to want to put something that you're interested in doing or something that's important to you. Maybe you like to garden, or maybe you want to visit with your family, or maybe you want to be able to take a walk in the neighborhood, or whatever those little activities are that you're really interested in that's important to you. You can put them in this box and then rate how well you do it. Now, let's say it's something like gardening, and you really want to be able to garden in the springtime. Well, if you can't do it right now, let's say you have some limitations there, you can bring this sheet to your doctor and say, I really would like to start gardening in the springtime. What are some things I can do now to help me do it then? In other words, what are some things we can do to sort of help me along so that I can reach that goal later? So that's how you use this top portion. Now, the bottom portion is very important. This is a plan that you can follow on good days and bad, just like we said before. But it's very important because when we are in trouble, when we're having a bad day, when we really don't feel well, we need to have a plan to follow. We need to know what to do so that we can identify those exacerbations or flare-ups early and make sure we're taking care of them right away so they don't get worse. So for example, here we have our traffic light. So green means good, right? It's just like a traffic light. So green means go. I'm doing well. My breathing is normal. I have the same cough and mucus I always have. There's nothing new there. I'm sleeping well. I'm eating fine. I feel good. I'm able to do all my usual exercises. Now here, you're going to just do what you normally do, whatever your doctor says you should do. So on the take action side, you're going to check off the boxes with your doctor or healthcare provider that applies to you. So for example, you might check the first box that says, I'll take all my medications just as prescribed. I'll just continue on with my usual routine. You'll also want to keep your routine doctor appointments. That's true for anybody. If you use oxygen, that might be a box you would check. You can also check boxes on exercise and different ways to avoid your triggers, things like that. So that's the green zone. In that yellow zone, things are starting to change here. So either an exacerbation or flare-up is starting, or maybe you're getting a little bit sick, or maybe there was a change in the weather and now you're feeling a little short of breath. This is where we want to take action. This is really the most important zone, because here we can take action that can reverse things a little bit, or maybe prevent them from getting worse. So here we're going to want to see what those bad days look like for you. So for example, do you have a low-grade fever that doesn't go away? Do you need to use your rescue medications more often? Are you feeling more tired or not getting enough sleep? What kinds of things are bothering you? You're going to want to check off those different boxes. And then on the right side, you're going to take a look at some of the actions you can take to help slow that progression of the flare-up, or maybe even reverse it. So here you're going to check off the boxes again that pertain to you. So maybe you'll want to limit your activity or take your regular medications as prescribed, or maybe you're going to start some new medications. And this is where your healthcare team comes in. You want to fill it out with them because they're going to tell you what to do in this yellow zone. It's very important to get a plan in place so that you can treat those exacerbations and flare-ups as quickly as possible. We don't want them to get worse if we can help it. And down on the bottom on the red days, these are emergency days. If you notice any of these signs on the left, disorientation, confusion, you're not able to speak normally, you have severe shortness of breath, terrible chest pain, if your lips or fingers look a little blue or gray, if you're coughing up blood, anything like that, you're going to call 911. And if your doctor or healthcare provider tells you to in this plan, you'll take some additional medications. That's something you will discuss with them together when you make this plan. But this is the COPD action plan. It's very important that you have a copy of this available to you. There's one available to you right now in your kit, and you can also get it on our website, which we'll talk about a little bit later. And you can download a copy for free for your own personal use. But next, let's look at our second form that we gave you, which is the Tips for Living Well with COPD. Now, this is just a quick tips sheet that gives you an idea of some things you can do to help yourself live well, stay well, and improve your overall health. So let's take a look at this in a little more in depth. We'll zoom in here. So at the top, we have our health and safety tips. Now these, some may apply to you, some may not. Everybody's different. But for the most part, these apply to most people. For example, the vaccinations. Those are very important. You want to make sure you get your flu shot every year and talk to your healthcare provider about other immunizations like the pneumonia shot, the COVID-19 shot, and anything else that might pertain to you. Everyone should be eating a well-balanced diet, maintaining a healthy weight, which of course looks different for different people. Maybe you weigh a little more than you should and you want to lose a little weight, or maybe you are a little underweight and you want to, get your weight back up. Talk to your healthcare provider or your doctor, and they'll help you to understand exactly where you fall and what you should be doing. You also want to make sure that you notify your healthcare provider at the first sign of an infection or exacerbation. Just like we talked about in our action plan, we want to make sure we have a plan in place, but we also need to have good communication with our doctor. And there's many other tips on here that you can read through and see what applies to you. But for the most part, the ones about, avoiding people who are sick, washing your hands often, all those things are helpful for anyone. second half of the page, you're going to notice some other things. Now, the next one here is the tools and techniques. These are some little tools that'll help you to live well with your COPD. So for example, if you're having trouble clearing your mucus and you're just feeling very congested, you can ask your doctor or healthcare provider about coughing techniques and different devices that can help clear your lungs. There are lots of things on the market right now that can help you with mucus clearance. You can also learn about different pursed lip breathing exercises for when you feel short of breath. That really helps to sort of calm your breathing and helps you focus on your breathing and just sort of relaxing. And that can be very helpful when you're short of breath. And some other items here are our COPD assessment test that you can take, and of course our My COPD action plan, which we already discussed. And you can also learn more about advanced directives so that your end of life wishes will be honored. Those decisions should be made by you and only you. For resources for individuals with COPD, you're going to find things like our website. You're also going to find our Guides for Better Living series, which is a series of 9 different booklets that gives you more information on COPD. You can also join our COPD online community called COPD 360 Social. And here you're going to meet other people just like you who have COPD and are living well with it. You can share ideas, you can share questions, experiences. It's a really nice place to be. And then, of course, we have our COPD Pocket Consultant Guide app for smartphones if you're interested in using that. And it tells you here where to find that. It's on the Google Play Store and also the App Store. If you'd like to learn more about COPD and download additional tools to help you manage your condition, you can visit us at our website. Right here is the educational materials section of our website, which is http://copdf.co/education-materials. I know it's kind of a mouthful, but if you write it down or even just save this slide, you'll find it pretty easily. Okay, well, thank you very much, and we'll be sharing some more videos with you soon. Thank you.